Hello, and welcome to Chairside Live. I'm your host, Megan Strong. Thanks for tuning in today. In this episode, Dr. Chi is restoring a failing amalgam filling on tooth number 4, a tooth that had recurrent decay. So he's cleaning up the tooth and restoring with a Camouflage Now onlay. And he's doing it chairside using the Glidewell.io in-office solution. Let's check it out.
Thank you, Megan. We have a 53-year-old female that presents with extensive decay on tooth number 4. The previous MO amalgam restoration has fallen out due to the weakened tooth structure. After evaluation, the diagnosis is reversible pulpitis. The treatment plan is to remove the decay and determine the restorability of the tooth once we reach healthy, sound tooth structure. From there, if everything looks good, then we'll plan to mill a chairside restoration to restore this tooth. Because caries spreads laterally along the DEJ, I use a coarse grit 850-016 diamond to extend the cavity along the DEJ in all directions until the caries is isolated in only the dentin. Once I reach healthy DEJ around the cavity, I use a carbide round burr to remove the remaining decay. I like using a caries indicator dye to help verify that I've removed most of the demineralized tissue. Since the cavity is quite deep, I'll place an indirect pulp cap using a GI liner. I first etch the dentin with phosphoric acid for about 5 seconds, then apply 2 1-minute applications of Gluma, followed by Vitribon. I now plan to restore the tooth with an indirect onlay milled chairside with the Glidewell.io system. For partial coverage preps, the goal is to remove any remaining defects, undercuts, and ensure the prep surfaces are smooth and rounded. In the areas where the margins are equigingival or subgingival, I pack a size 2 cord and allow it to sit for at least 5 minutes to provide adequate gingival retraction for our digital impression. From an occlusal view, we need to ensure that we can visualize all of the prep surfaces and margins simultaneously. Here, my assistant Vera is capturing the digital impression of the area using the iTero element scanner. Once the prep, opposing, and bite registration are scanned, the data is transferred to the Fast Design software that proposes an aesthetic and functional design for our onlay. Once I'm finished setting the proximal and occlusal contact parameters, the electricfastmill.io machines this onlay in only 7 minutes using Camouflage Now, which is a hybrid resin ceramic material that I really like using for partial coverage restorations. Once the restoration is completed, I remove the sprue and polish the onlay using Clinician's Choice ASAP polishers. Once the restoration is checked for fit, this material needs to be properly treated prior for bonding. When developing this Camouflage Now material, our research and development department performed extensive tests to determine the optimum bonding technique for camouflage. For the restoration, the internal surface of these resin-based materials need to be etched using 50-micron aluminum oxide. Once etched, rinsed, and cleaned, we apply Kerr's OptiBond XTR adhesive to the internal surface. To keep film thickness to a minimum, we aspirate the excess, air thin, and then light cure for 10 seconds. On the tooth, we use a total etch technique with phosphoric acid, followed by 2 1-minute applications of Gluma. Then we prime and bond using Kerr's OptiBond XTR. I seat the restoration into place using Kerr's Maxim Elite Dual Cure Resin Cement. The excess is easily removed after a 2 to 3 second tack cure. This onlay is another example of the power and flexibility of the Glidewell.io chairside system to provide a high-quality and efficient treatment for our patients. In less than 15 minutes, we were able to scan, design, and mill this restoration using Camouflage Now. Offering these conservative restorations in a single appointment is very easy to do using the Glidewell.io chairside solution, and should hopefully be a service all dentists can provide their patients in the future. Thank you for joining us for this episode of Chairside Live. Back to you, Megan.
Thank you for that, Dr. Chi. For more information on the Glidewell.io in-office solution, head to glidewell.io. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Dental, thank you for watching, and I'll meet you right back here next time.